Right. So good evening, everyone. Thanks for coming out to the Human Services Committee meeting. My name is Jewel Jones. I am the chair. It's June 8th. It's about 6:34 p.m. All right. There's some. So there's some ground rules, everyone. No one may speak until granted the floor. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand from Zoom, click the participant's icon and you will find the raise hand function there. Members should not engage in back and forth discussion. The chair will recognize the next person to speak. Please keep your questions and comments brief and on topic for the discussion. Members of the public, if you have a question or comment about the subjects on the agenda, please raise your hand and wait to be recognized. Okay, so I've calling the meeting to order. I've done that already. Well, there's a roll call.
Leslie Colon, present. Honorable Lizzie, present. Chancellor Gregg,
President.
Bill Jones,
Here.
Jennifer Myers, present. Tanya Phelps,
Present.
Darren Fonzie, present. And Robin Strachan.
Present.
Okay.
There's a form second.
And I don't have that. I know people say we're joined by our, and I don't have it. We're joined by our, what's your title? Associate Marlene.
The boss.
And Marlene, thank you. So now I'm gonna actually adopt the agenda first or read it.
We just read through.
Okay, so I'm gonna actually read the agenda for folks, the whole agenda. So there was a call to order, roll call, adoption of agenda, approval of committee minutes. The approval will be of the May 11th meeting minutes. There will be some announcements. You will hear from DOHMH and the RAD Academy, which is taking place actually next Monday, but we'll speak more about that. We will hear, well, I will discuss public health solutions, the New York City Smoke-Free Coalition meeting, which is taking place on Tuesday, June 9th. East Harlem Community Partnership monthly meeting, which is taking place Wednesday, June 10th. Public Health Solutions webinar, which was taking place on Tuesday, June 16th via Zoom. Antonika James from Housing Works Community Healthcare shared some resources with us. I will talk about that. Pauline Ferrante from the Manhattan Liaison from the Office of External Affairs of DOHMH shared some proposed rules that were approved for publication by the Board of Health, and the two rules are actually highlighted there. Notice, I'm not going to read two. So the two rules, they're basically Article 173 and Article 205 of the Health Department. They will have some informational updates from our agency partners and our other community stakeholders, among whom are Department of Health and Mental Hygiene. We will have CAB reports for those who are CAB representatives. We will hear from the New York City Human Resources Administration, Department of Homeless Services, New York City Department for the Aging, Office of Immigration Affairs, Department of Veterans Affairs, East Harlem COAD Emergency Management, Center for Comprehensive Health Practice, Housing Works Connect programs, on point. Now, if any of these entities are here, we will hear from them. Then we have our presentations and discussions. We actually have Mount Sinai here, Brad Beckstrom and Jan, how do you pronounce it? Schutzmuller, and Brad Beckstrom from Mount Sinai. They will discuss Mount Sinai's approach to mental health services and psychiatric emergency care. And then we will discuss district budget consultations. We'll draft some agency questions and review the budget responses received from various city agencies. Under old business, we're going to have like committee report outs from various committee members who attended meetings. So among them is Ada, and I attended the Volunteers of America meeting. I attended the New York State Health Department's 5th Annual Community Emergency Network Conference on Wednesday, May 20th. That was virtual, and one of our members attended the Citizen Preparedness Training of Gutman Community College on May 13th, of which I am the Chief Diversity Officer and Timeline Coordinator at Gutman Community College. And then under old business, we did receive a response from Madison Ayala of Manhattan, the Manhattan Government Affairs Officer of Department of Aging. I wanted to make sure you all saw that response, and then new business, roll call, and an adjournment. That's the extent of the agenda. I'm gonna ask for an adoption of the agenda, and if there are no objections, we can adopt it unanimously. Any objections?
No.
Unanimously adopted. I'm gonna ask for adoption of the committee minutes of the May 11th, 2026 committee minutes, and if it's no objection, we can adopt that without without objection. Any objection? No. We will adopt that. All right, so we're moving right along. We're up to announcements. There's someone here that wanted to, I'm gonna probably let you go first. This individual was at our last community board meeting and, spoke as a member of the public, and we asked her to come to this meeting. And if you can just kind of briefly let us know your concern or, what you want or how we can assist, we're happy to hopefully assist.
Amazing. Good evening. Thank you for letting me speak briefly. My name is Jennifer Hadlock. I live in East Harlem since 2009. Love East Harlem. Also suffer from depression and I'm a peer mental health specialist and support other people with mental health challenges. But right now I'm working with New York Lawyers for Public Interest. We're trying to document people's experiences with mental health crisis response, and specifically Be Heard, the Behavioral Health Emergency Action Response Division program that Mayor de Blasio started that was supposed to get police out of mental health crisis calls. It actually started here in East Harlem, but I find most people have never heard of it. But I'm trying to find people who have had experiences with Be Heard or with other kinds of crisis response. I have an electronic version of the survey, a paper version of the survey. Happy to come and talk to groups about what we're doing. I brought some flyers, English and Spanish, if you would pick them up at any place, like at your church or at your office or any location, would be alright to put them up here in the office. That would be amazing. Like maybe get something to happen at Mount Sinai, which saved my life with cancer. Thank you. So
Thank you. And just say your name again and your contact information, or
Jennifer Hadlock. I put my information on the signage.
Okay, and I
can pass these around.
Yes, I'll make sure we get over here first. Well, yes, Robin.
Thank you. Can you hear me?
Yes, we can. Thank you.
Great. So the annual Power of Aging Well, which is a co-sponsorship between the Office of the Local Council Member and Metropolitan Hospital, will be taking place September 2nd in Jefferson Park. I say it now because I think when the emailing will be going out to offer tabling, it's probably going to be after this committee breaks. So if anybody's interested in tabling, please, you can call me and leave me a message at 917-565-4009. This, by the way, attracts over 500 local older adults on a beautiful day in the fall. Thanks.
Say the date again.
September 2nd, rain date September 3rd.
And you said the flyer will be coming out?
It will be coming out, but probably after this committee breaks for summer.
Oh, yeah, sure. But then we can always just like send it on and be on the website. Thank you.
Great. You're welcome.
Thank you, Robert. So I do want to go over a couple of these announcements. I just kind of mentioned them in passing, but there's a flyer that's being passed around. This is very important. We need to make sure that folks know about this DOH-MH Rat Academy training that's taking place next Monday, 5:30 at El Museo del Barrio. Folks should come out who are impacted in terms of vermin, etc., that in and around East Harlem. These are the folks that you want to speak to in terms of like mitigation and offer ideas, solutions, but they can also discuss what their mitigation efforts are as it relates to rats and other vermin. So it's very important that the word is spread, that you let everybody know. Residential buildings, please make sure your landlords and TA presidents, etc., are aware of this. It's very important that folks come out. Yes.
It would be good to make sure all the people around Second Avenue subway know. I know the Rodale Pleasant Garden got torn up and the rats were are crazy. All the landlords over there, I can pass it because I was there, I'll pass those slides around, but all the construction going on is definitely that maybe.
Exactly, yeah, exactly, especially those, yeah, along Second Avenue, I guess, thank you so much. And just the other things, there are other, events, taking place, some of, I have like, kind of things you can actually click on in terms of links if you want RSVP, but this is also very important information. And that's all in terms of my announcements. Any announcements from any other committee members? Okay. All right, moving along. So we are up to informational updates from our agency partners. And we'll just go through them. If you're here, where the folks outside in the thing, obviously. Did they come in? Well, I was talking to them. Okay, because I think they're from the health department, but I should probably come in. So the city health department, if someone's here to speak, let me know.
You want me to go check?
Yeah, or just yell. Thank you. In terms of CAB reports, that would be Metropolitan Hospital, Harlem Hospital, Henry J. Carter, even Mount Sinai. CAB, are these folks from,
That was HRA, but it was the wrong thing. That was their outreach team. They were just trying to create some signs about the benefits.
okay. Are they gonna come in here to say something though?
No, they didn't they weren't prepared for that.
Okay.
So they just and some materials like IDNYC.
Okay. Thank you. Okay.
They said the wrong group.
So the HRA, or Department of Homeless Services, here, anyone? New York City Department for the Aging, Office of Immigration Affairs, Department of Veterans Affairs, East Harlem COAD, Emergency Management. Yes, yes.
Hi,
Yes.
it's Antonika. I'm gonna speak also on behalf of the COAD for tonight as well. So I'm one of the members of the COAD. Just letting people know, for those who are not aware, the East Harlem COAD stands for Community Organizations Active in Disasters. And so just a few brief updates that we have. The COAD actually had last month a new office welcoming and opening. So there is a new office space for the COAD, and it is located at the Department of Health on 115th Street in the Neighborhood Action Center in room 119A. And right now the office hours where COAD members will be available is going to be Tuesdays and Thursdays between 10 a.m. and 2 p.m. So just in case people want to stop by or would like, information, need to pick up supplies or anything like that, there will be folks available at that time. The next meeting for the COAD is going to be on June 18th at 4 p.m. And that is going to be at the Health Action Center space. And they're going to be focusing on messaging around the Legionnaire's disease. And there are just a few things that they're going to focus on in regards to Legionnaire's itself being a serious lung infection, what type of conditions or impact that it has on folks who may have respiratory issues, how it spreads, focusing on the spread through building water systems and not it being like a person-to-person contact, that understanding how some people are at higher risk than others, understanding the symptoms of, folks who may have been exposed to it through their water systems and how to act more quickly in receiving any support or some treatment on that, and also understanding the building safety for the buildings that they live in, work in, go to for meetings and things like that that could potentially be impacted. And so understanding that Legionnaire's is knowing the symptoms is really going to be helpful for folks in the community to have more information about understanding who is at higher risk, keeping the water systems safe, and being able to help protect the community is going to be the focus for that upcoming meeting. And there's going to be a micro learning session at that meeting, which is going to be more of a Legionnaire's Disease 101 session, what it is, where it hides, and how we protect each other. So that's going to be the focus on the June 18th meeting.
Okay, so, there was just some legislation as it relates to cooling towers. Are you aware of that in terms of cooling towers and Legionnaire's disease and spread?
Yeah, so that's all going to be focused. They're going to discuss all of that at the meeting.
Good, good, great. Any questions about that part of it? COAD? So this is the first time they've actually had like a space identified for the COAD? Is that what you're saying?
Yes, yeah,
great.
the COAD finally, yeah, they finally have been able to obtain space at the Neighborhood Action Center.
That's great.
Yeah.
Okay. All right. So you were speaking on their behalf, but you're from Housing Works?
Yeah, so yeah, Antonika, yeah. So
Thank you.
yeah, I'm also with Housing Works Community Healthcare, and I'm with the Connect program. So we are a community-based behavioral health program. And so what we do is go out into the community and raise awareness in breaking down stigma around mental health, and come up with creative ways to bring those services to folks in the community and connect them to therapy services as well as case management services. And we do all of that without any billing. And so we still have an ongoing project that we're doing in the community. The link was shared for folks who are interested in contributing to our community mural project. We can bring our mural to you. Folks in Harlem can express what wellness means to us in Harlem, and we're happy to come out. We bring out on our second installation of it now. And if folks want to have a painting session and host it, we're very happy to collaborate with folks and let them be able to contribute to what this mural will mean to us in the community. And we hope for it to eventually scale up into, poster size, maybe even billboard size, depending on how big it gets. And we're hoping that there are folks who are interested in wanting to have us come out and make that connection with them, but also just being able to utilize this opportunity to really express what health means to us in our community. And
Great.
that's pretty much what we have going on right now.
Thank you so much. Are there questions from folks? Any questions online? So thank you very much, Ms. James, for coming. Always a pleasure. Any of the other partners, agency partners that I've missed? Going once, twice, three times. All right, so now we're up to presentations. So now it's Mount Sinai. Again, Brad and Jan. Okay.
Why don't you go ahead? Actually, Dr. Mueller will really cover most of it. I think, Mount Sinai, we're very committed to behavioral health services. And actually, Jan is chairman of the Department of Psychiatry for Mount Sinai. So he can address all of the questions. But I think we'll run through a PowerPoint first and then take questions after that. I'm ready to that.
Thank you.
All right, thank you. So you bring up this PowerPoint. Just a correction on the vice chair.
Oh, vice chair.
Okay. So I guess I can start already a little bit. Thanks for having us and for inviting us. Should I sit somewhere else or stand up?
So I think as long as people can see you on this thing here, so you can on the scan, might be, it's coming forth here, so.
Oh, on the board, I see.
Yeah. This is like flashing around. Yeah, oh, see, that's her. Thank you so much.
All right. So I'll talk a little bit about the psychiatric services we have at Mount Sinai Hospital. But I'm also going to talk a little bit about Upper Manhattan because we have other campuses as well. Up on 124th Street, we have our own health center, and then over on the west side in Mount Sinai Morningside. But I'll spend most of the time talking about Mount Sinai Hospital right here that we are. I'll just look them.
It's okay, it's just text stuff.
Anybody?
You gotta find where it is in which time.
Let me bring some of those, That's
Yes.
the thing. It's up to you. That's the thing. Thank you. Thank you. How about those next? How about the World Cup? How about everything that's happening? How about Taylor Swift and what's his name? How about? What's going on?
That's what they're getting at.
No, this is, no, this is, people like
It's a
that.
rumor, but.
Yeah.
You think it's not true?
Yeah, well,
I don't think so.
no. The police commissioner made a joke about it, don't make a joke about that.
Oh.
Yes.
There you go.
Okay, great. All right, thank you. Okay, you can go on to the next slide, please. All right, so, as I mentioned, so we have campuses all over the city, all over Manhattan. I'm gonna be focusing up, not for Manhattan, but as you see, in the pink, Mount Sinai Hospital, right where we are, and then up on 124th is, Health Center, Morningside over across the park, down further, towards Midtown is Mount Sinai West, and then on the Lower East Side, we have the Mount Sinai Behavioral Health Center. And we have the smaller stars are some opioid treatment programs as well. Yes, next slide, please. Oh, that's just a highlight, the Upper Manhattan. Okay, going please. All right, so we'll focus first on Mount Sinai Hospital. Slide. And we'll talk about outpatient services and inpatient, our emergency room services, and our consultation services. All right, so starting with outpatients. So we have a couple of clinics at Mount Sinai Hospital that serve our outpatients, our adult and our child and adolescent. Our adult is, as the name implies, adults 18 and over. We service the East Harlem, Upper East Side community. And we treat people with all psychiatric diagnoses, and we take Medicaid, Medicare, commercial insurance. Our volume is about 29,000 visits per year, and at this point, about 50% are virtual. So that's, over the last 5-6 years, pretty much since COVID, that's really, made a big difference. Before, everything was pretty much in person. But it offers us more flexibility, and a lot of patients, especially if they have mobility issues, et cetera, can have more access to care that way. So it's a great alternative. We provide medication management, individual psychotherapy, group psychotherapy, family therapy at that location. We also have, it's not quite live yet. We're going to be starting up an intensive outpatient treatment program at the end of this month or early in July, which is a more intensive outpatient program, as the name implies, where individuals are seen at least 3 times a week versus weekly or monthly. And it's a great resource because people who need a high level of care can be treated successfully without necessarily having to go into the hospital. It's also a good step down opportunity for people coming out of the hospital for more intensive treatment before they reintegrate fully into the community. So that's coming up soon. We also have On Track New York, which is a specialty program that treats individuals with signs and symptoms of early psychosis. So this is for younger adults, 16 to 30 years old, people who've recently been diagnosed with a psychotic disorder. So for instance, somebody who might develop schizophrenia, so suffering from psychosis, can get treatment in our On Track program, where they provide medication, psychotherapy, individual, also a lot of group therapy, but also educational, vocational support, and they also do home visits. So it's really a wonderful program, very comprehensive. They even do field trips. A lot of them, a lot of the individuals are of the same age or younger adults, so it's a real the sense of community in that program. It's only about 2 years old so far, and you know, we hit our maximum capacity very quickly. It's a very popular program. They have them all over New York, so that wasn't a surprise. It's highly sought after, and hopefully we can expand that. So that's our adult clinic, and it's located, by the way, at 1160 Fifth Avenue at 98th Street. Then we also have our child and adolescent services clinic, short CAPS. That's on 1240 Park Avenue, so just down the street. And as the name implies, it's we treat patients under the age of 18, but also their family members. So we do family work. And again, it serves the Upper East Side and East Harlem community, where they treat kids with all psychiatric diagnoses, Medicaid, and commercial insurance. It's a small clinic in the adult clinic, so it's about 12,000 visits annually. And as expected, a smaller percentage is virtual. It's just not that easy doing virtual care with kids, easier with adolescents. That's those are our main clinics. Then moving on, next slide, please. We also have integrated services. So these are still outpatient services. So integrated means it's actually a different kind of specialty clinic, but we have psychiatrists embedded in those clinics. So for instance, in primary care, we have a psychiatrist who lives in the primary care clinic. He sees adults in primary care, but it also works with other primary care providers that may be treating patients who have comorbid psychiatric illness. So somebody who's being seen in primary care, who also has depression, can be managed in the clinic. So to have sort of one-stop shopping, you don't have to refer to an outside specialist. You can just get all your care at the primary care clinic, and that psychiatrist will work with the primary care physicians, for instance. There's also some social workers that are dedicated exclusively for working with individuals, short-term counseling, people with depression. That's a great resource to have people sort of remain in the clinic that they know and they like going to. We also have 2 psychiatrists who are embedded in our oncology clinic at Mount Sinai. So the Dubin Breast Center and Ruttenberg Treatment Center are our 2 cancer clinics. And so those psychiatrists are embedded. They work with the population who's been treated for cancer. So again, that they get all their care under one roof. And then there's the Dean Center, which is a program that's for individuals, elderly individuals with cognitive impairment, so dementia, whether that's early or later. It's a collaboration with neurology, geriatric medicine, and psychiatry. So there's psychiatrists and neurologists, geriatric medicine specialists. So they work together to provide comprehensive care for those individuals, multidisciplinary care. All right, I think that's it in terms of outpatient services. Next then is our inpatient service. So we have here at Mount Sinai Hospital, we have 2 inpatient units. The first one is our general adult inpatient unit, which is 25 beds and 18 or over. Again, you get the idea. It's always the community. Here we treat individuals with all sorts of diagnoses, regardless of insurance or uninsured. Basically, people come into our emergency room, psychiatric emergency room, which I'll talk about in a minute. And if they need treatment inside the hospital, they will get admitted. So we have patients who are admitted voluntarily, but also if they are dangerous to self or others, then they may be involuntarily admitted as well. Our volume is about 550 discharges a year from that unit, and we provide medication management, but also psychotherapy, a lot of group therapy, but also individual psychotherapy. And our length of stay is about 15 days then, our average length of stay. We also have a geriatric inpatient unit, and you see it says geriatric/adult. It's mostly for, individuals 65 and over, but also younger people can go there. As long as they are calm enough to be, in the same space with our more elderly patients. Again, same community, the volume is smaller, it's 21 beds, so we have 300 discharges a year. Length of stay is somewhat longer, about 17 days there. And again, we provide medication management, individual group psychotherapy, and of course, we have social workers there that work with individuals to make sure they have a good aftercare plan, and any services that they may need are addressed before patients are discharged. Next slide, please. So moving on to our emergency services. So we have a psychiatric emergency room here at the Mount Sinai Hospital. We see individuals of all ages, so also including children, adolescents, from the neighborhood, from the community. Again, all diagnoses, all insurance statuses, and we have about 1,400 visits annually, thanks to our volume. The last bullet point, so we will eventually be converted to what's known as a CPEP, or a comprehensive psychiatric emergency program. That's happening later this year. But what that basically means is that we'll have some beefed up services, emergency services. We'll have a mobile crisis team as well. So a team that can go out into the community to help individuals in crisis. And so that should be coming probably in the fall. We'll be ready. We also have to build some beds, some extended observation beds where people can stay, basically be part of the emergency room for up to 3 days. They don't have to be admitted fully. They can get stabilized in a short-term setting, and then you return back into the community. So that's going to be great. It also means we have more social work services in our psychiatric emergency room, so we can offer more follow-up care as well. So I think that's going to be a really positive change for our emergency service. And the last arm of our department is our consultation service. So the consultation service works with individuals that are admitted at Mount Sinai Hospital for medical reasons. So if somebody is admitted, let's say, for complications of diabetes, and they're on the medical floor, and they have a psychiatric diagnosis of psychiatric illness that needs some sort of attention. So we have a psychiatrist that will see the patients on the medical floor and do a consultation. And again, we actually have all ages. We also have a pediatric consultation service. And so we work with all the individuals, any age, that are hospitalized and need psychiatric care. And those people can end up getting discharged with a referral if they need it, or if they have existing services. We will coordinate with those existing services, and where they may need to be admitted, whatever the individual needs. And we have it's about 1,300 consults annually at this detail. How am I doing on time?
Good.
We're good?
Yes.
Yes, we're good. All right. All right, so that's Mount Sinai Hospital. Any questions about Mount Sinai Hospital before I move on? Well, I'll go on.
Yes, so I do. So so a couple of things. I'm going to start by saying this: the committee and the board as a whole, we have what we call a moratorium in place in terms of any drug treatment or any psychiatric services, et cetera, that they have to. There's a moratorium on that. Do you deal with the OASIS? Okay.
In general, yes. Yeah.
So I don't know if you saw the actual document itself. It's on our webpage. So it basically says this, that that it's a moratorium on on the citing and expansion of substance use treatment facilities within Manhattan Community District, but it's more than that. It's also like psychiatric or drug treatment centers and things of that nature. Would any of this, what you just said, fall under what I've just said?
You know, right now,
Even like,
one of the programs at Mount Sinai proper are licensed by Oasis. We do have a system, they're part of Beth Israel.
okay,
We do, as you know, on 125th Street. Have some OCP programs and methadone treatment programs. They're actually licensed to Beth Israel, but, you know, we have no plans, to add programs. Bringing in programs, when you talk about, you know, your moratorium or your, you know, we have no plans to add any services in CB11 area.
okay, that was one thing.
Well, sorry, just to clarify, so that's all psychiatric and substance?
I would say
treatment, or-
any services under the purview of Oasis.
Okay, yeah, so we have nothing planned, yeah, and again,
Education service.
nothing under, that's addiction, nothing at Mount Sinai's licensed to the at Mount Sinai Hospital.
Okay. So the other question I want to ask about is in terms of, I'm just gonna speak like generally in terms of like discharges, okay? And within my question is gonna be this. I think about a month ago or 2 months ago, there was an incident in and around Mount Sinai, Mount Sinai, in terms of an individual who had maybe psychiatric, right? And can you expand about how that was handled? I know the police, the precinct was involved, but how, can you talk about how Mount Sinai handled that?
So as I recall, and now that you remember the details better than I mean, it was actually, you know, the NYPD that ended up apprehended the individual. So we had, you know, our emergency department, we have, you know, and then whatever you call the machine you walk through, a metal detector, that's really not the right thing, as well as an off-duty police officer. So essentially what happened is the individual started to enter the building, and he realized that he had the metal detector as well as off-duty police officer, and he left the building. And then he never came back in, but he did have a weapon. And then, you know, police were called, and again, you know, maybe we really should do a discussion with our security folks, we're going off memory here. You know, NYPD was called, and they chased him down, and eventually several blocks away is where the gunfight was.
And do you know if he had any affiliation or connection with Mount Sinai at all? By any chance?
Affiliation in the sense that he had been seen in one of our emergency rooms at some point, but that was, I'm not sure when that was, when this occurred. This was like last year though, this happened, right? And then he had been seen some months before that in our emergency room. But he was not from what I understand, he wasn't an individual who was getting care, regular care at Mount Sinai.
So I started saying like the word like discharge. So in terms of like discharges, and I might be speaking like generally about that, but when folks are discharged, in the community, so is it in the community, outside of the community? And in terms of like follow-up, how does that work?
So can you specify discharge from an inpatient service or discharge from
No,
the clinic or
I'm thinking like outpatient services.
discharge from outpatient
Yeah,
services?
that's the right word for discharge.
So, yes, so if somebody's getting care at our clinic and then they are no longer receiving care at our clinic, then they're discharged. So for instance, if somebody moves away, they move upstate and they're no longer going to be receiving care at our clinic, then they're discharged. Or if somebody says, I want to now pursue care, I don't know, somewhere else, with some other clinics, then they're discharged and no longer getting care. So it really depends on why somebody is being discharged from our clinic. If they have a follow-up somewhere else and they wish to go there, then that's fine. We will make sure that somebody has follow-up treatment. If for whatever reason, you know, they can't attend anymore or can't come to us, we will try to work with them to make sure that they have some sort of treatment elsewhere. So for instance, you know, a resident that I was supervising, one of her patients moved upstate. That's why it's fresh on my mind. We worked with the individual remotely until we could establish a connection with the provider that that person would be going to upstate. So we make sure we take care of patients until, for whatever reason, we can't anymore. So that's discharges from our clinic. So if that's what you meant.
Yeah, I'm gonna ask a lot of different like questions. So another question I'm gonna ask, and you may not be feel comfortable responding to this, but, and this has to do with another facility, Bellevue. So, you know, there was that incident where that, person was at Bellevue, discharged, and then, you know, pushed someone down the stairwell. I want to kind of get your thoughts about that. I realize it's health in hospitals, I realize it's public, but in terms of like how something like that could have happened, I just get the thoughts, or if you don't feel comfortable, you know, responding or anything.
No, I mean, I think I can't speak to that incident because I don't know what happened. I don't know who the individual was or really what services they received or needed. How does that happen? You know, I think a lot of things can happen with this, you know, it's a big city, there are many individuals who need care. So, I think our responsibility when somebody comes into our emergency room or a psychiatric emergency room is to do an assessment to make sure that we are, you know, assessing them for risk, which we do for everybody. And we try to connect with people that they are, you know, are working with, or family or friends, and to do a proper risk assessment. And then, you know, do the right thing, whether that person needs to be admitted because they're dangerous or not. You know, there's so much that you can do, but sometimes you also don't know, or somebody's not being forthright, or there's only a limited amount of people you can contact. So, you know, I hope that never happens again. You know, again, it's a wake-up call for the whole city, I think, to make sure that whoever's coming through our emergency room, we assess properly, and, you know, do the best we can. There are also new, you know, regulations in place that make sure that, through OMH, that make sure that people who come, who have complex needs, as they define it, are assessed properly, you know, make sure that we check all the available databases, that OMH, and Medicaid make available to us. So there are the regulations in place, but also practices in place to make sure that we're assessing people correctly.
And I appreciate that, you know, you really, I realize it's a separate entity. So I think you have to. Yeah.
Thank you for this presentation.
I do have a little bit more if you like, but it's not so relevant to this
The
neighborhood.
question maybe really highlight that at the end very quickly.
So I had a question, if you or the Mount Sinai Hospital has outcome data in recovery rate, the time of treatment, if there's reoccurrence in some of the patients, or if there's overdose deaths, and if these numbers can be allocated specifically to East Harlem, so we can know maybe the percentages.
Yeah. So, the short answer is no, we don't have all of that, what you just mentioned. We have some data, right? For instance, you know, you can look at readmissions, but that's also limited by where you're getting this data from. We can track our own readmissions, but not necessarily. Sometimes we can, right? Because some of the hospitals are in the network together and can sync up the records, but it's not a great solution for collecting that data. In terms of outcomes, we are moving more towards standardized assessment tools to make sure that we have better data that we can also accumulate, and then you know, that you can do these kinds of analyses. So at this point, you know, while everybody is getting individual care, it's not completely standardized, for better or for worse. Standardization has its, you know, pros and its cons. But in terms of data collection, it's great. So we are moving towards that. So hopefully we'll have better data in terms of outcomes not for every type of illness, but for instance, for depression, you know, there are a lot of good scales that one can utilize. And once we have that rolled out, we can then collect that and have a better understanding. And then you know, that's a matter of filtering it out for the neighborhood. So that's doable eventually, but at this point we don't have that. Also, yeah, overdose. Oh, we mentioned overdose deaths.
Yeah,
That's not something.
because we have like a section on the moratorium about that we service more than there is a need in East Harlem. so it would be relevant to that.
There's more services than are
But
needed.
needed in East Harlem. The numbers, from what I recall, it was, I think it's 15% of New York City substances treatment capacity is based in East Harlem, but the need is only 4%.
Okay,
So it'd be nice to see if your data, if you have any.
yeah, we don't have
We know
that.
that in data. And the other, we talk about the OTP clinics, I think one thing important to, really highlight is we hear you loud and clear. And obviously, we struggle with clearly that, there is a need, and we want to provide the care to our patients. But we've also heard some of the concerns. And one thing that we've done, in particular, you're probably talking about the clinic in the so-called lead building, going at 125 in Lexington or whatever. We actually, over the last few years, have done several things. Number one, we've reduced the number of daily visits, and really, now you may know clinically better explain this than I, but previously, individuals had to virtually come in daily to receive their dose of medication. We're now able to give them several days at a time, not for everybody, but many individuals can do that. So we've reduced the number of visits, the daily visits, by almost half, weekly visits. The second thing that we did is actually we stopped, we closed the clinic on weekends because it used to be open this Saturday, but it was open at least part of the weekend. So we did that. And then we also hired a new security firm that there were a lot of concerns, and they hired a new security. So we are trying to address those concerns at the same time providing care for our patients.
I have one more question, and I took some notes. So, do you have issues with getting providers, and are you short on staff, with all these numbers, seems that they're quite high, that there's a high need? And if so, I looked, there are several sources that they actually provide loan forgiveness program for doctors and nurses. And do you think it would be helpful to post them in your website, like to attract more people to apply? Because it can go, from what I saw, even $50,000.
Yeah, no, I know.
And then it seems like they have to serve the community for up to 6 years, so that would be beneficial to the community.
Yeah.
Also, send providers.
I should knock on wood when I say this, but we're actually good with providers at this point. I will knock on wood because it can always change. We did see a drop with COVID. I think people were, there's in psychiatry, you can work pretty easily remotely, right? And I think there was a move for people to work from home remotely. The technology was, omnipresent and so easy to manage that a lot of people found that enticing. So ask me, 3-4 years ago, I would have said, yes, it is hard to hire people. But over the last 2-3 years, we've really seen that come back. People don't want to work from home and they want to work in a hospital setting. So we've been very happy. We've been very happy in terms of hiring to see people wanting to work in hospitals, but also at Mount Sinai. But yes, we do have people that take advantage of those loan forgiveness programs.
Participated with loans, but
Yeah.
you kind of earmark for money for institutions. There's nursing loans as well as physician.
Right.
And we do have people utilizing them.
I have one more question about the other speak, and then if I have time.
Or see if there's a
Yeah.
presentation.
Oh, I got a question.
Is it okay? That's okay. And thank you for coming in. You said that you have a lot of people coming in through EMS and the emergency room with the police department with their handcuffs because they're tired to the community or to themselves. Once they come into your establishment and they get processed, are they still considered under arrest because they're putting in handcuffs, or are they released into the security system of your emergency room?
So if somebody comes in handcuffs, right, because the police sort of restraining that way, but they're not under arrest, then, security leaves them at the door. Police leaves them at the door, hands them over to us, and we will take it from there. If somebody is arrested, right, and awaiting arraignment, that's a different story. But if they're just brought in by NYPD for whatever reason, and happen to be in handcuffs, then we really ask that the police step away. So we try to have as little police presence as possible in our emergency room. But yes, and sometimes there's a back and forth in terms of what they want to do and what we want to do. But yeah, I can say we really don't want police presence there. We want to deal with the patient situation ourselves.
But if they're an inpatient, they're never, or if they are under arrest, they're not discharged per se to us. I mean, they're still under the jurisdiction of NYPD.
Okay,
Yeah,
now,
so security does not take over there.
okay.
No, yeah, if it's an arrest waiting for arraignment, then they have to be in police custody.
Even though they have a say, might have a psychotic break at that time.
Right, I mean, we compare it to somebody is under arrest, but they have a medical need, like that maybe they have, whether it's a broken leg or diabetes, they're still under arrest, so they're still in police custody, but they will, make sure that the medical or psychiatric issue is taken care of. But it's not an easy situation. It's definitely very challenging in those cases, yeah.
Now, EMS has a whole statistics and they all have this whole thing, and that's like your source of income, anything that comes to the emergency. That's the nucleus of the hospital. Everything comes to the emergency room and then they get filtered upstairs. So all the statistics that EMS have throughout this community, it should filter into your system so that you see what budget if you can provide for different allocations of care. And this seems to be the highest one in the community that's going on right now with mental health care. So because of the high volume, and we have the Be Heard units within EMS that are working within the precincts, the 23rd precinct, 23rd precinct, because they just cross over back and forth. With that, we should be able to have more statistics of inpatient, outpatient care, more of what's going on after the emergency room. And I understand you have 25 beds for adults and then 21 beds for geriatrics. Is there any capacity that it can be expanded at any point in time?
So I guess the question is, do we need more beds, or you're saying we need more beds?
Well, because of the volume that's growing and the capacity that's going through the emergency room, as they get filtered up into
Yeah.
the admissions and all the capacities, medical, surgical, and psychiatric, will this bed count expand as well?
So at this point, there's no plan to expand the bed count, but that's because we see that we are meeting the needs of the community. We are not, constantly at 100% full. If that were the case, we have too few beds, we would be at 100% capacity the whole time, which we're not. So if there comes a point where, we are at 100%, we have to think about we need more beds. But also keep in mind that Mount Sinai is a health system. So we have, like I showed you, all the different campuses. Yeah, we have all of those different campuses that also have inpatient beds. So we have set up an efficient system where if somebody comes into one of our emergency rooms for a CPAP, psychiatric